Hello. Hi, my name is Priscilla. I'm your student nurse for today, and
Hi, my name is Avani Patel. I'm also a student nurse.
how are you doing today, Mr. Garson? Can you check his armband, Avani?
His name is Discharge.
What's your name, sir?
Rob Garson,
What's your birthday as well?
12/24/1984.
Okay, Mr. Garson, is everything okay? You look kind of sweaty.
Yeah, I feel some pain in my chest.
Some pain in your chest? Okay. Let me put the head of your bed up a bit. You want to start checking this out?
Yes, I would like to check the vitals.
Okay, Mr. Garson, I'm going to listen to your respirations, okay?
Okay.
Or I'm going to feel your respiration.
Oh, pulse is 110.
Okay. Okay, respiration is
Would you check the oxygen?
pulse ox. Yes. How are you doing today, Mr. Garson? Everything okay? Are you feeling any way? Is that raising the head of the bed a bit better for you?
A little bit. I still feel anxious and a little short of breath.
Okay. Well, your pulse oximetry is about 83%, and your respirations, let me check your lungs here. Can you take a deep breath for me, Mr. Garson? Okay, Mr. Garson, you seem to have a little trouble breathing. I'm gonna put on your pulse oximetry for you. Can you do that for me?
And the blood pressure is a 170 or 90. Looks
170
like
or
more. Can I have gloves, please?
Here, just take this one.
I will check the dressing for you, Mr. Garson.
Okay.
The dressing
this?
look intact.
It
No
looks
bleeding.
okay, no bleeding? Okay, Mr. Garson, I'm gonna put this on you. Just let me know if it's tight. Is this to help you breathe a little bit?
Okay.
Okay? And I'm gonna put it up to about 2. Okay, do you feel a little bit better, Mr. Garson?
Just a little.
Just a little? Okay, I'm gonna
Get more.
put it up a bit. Mr. Garson, since your vitals are looking a bit high, I'm gonna call your doctor to see if he has any medications that we can put you on to make you feel a little better, because your heart does hurt you, okay?
Okay.
I will stay with you.
Hello, Dr. Smith? Yes, we have your patient here, Rob Garson, that you did a total knee on 2 days ago. He's having a little bit trouble breathing, and he's complaining of chest pains. Yes, his blood pressure is 170/90, his pulse about 110, respiration's 30, and his pulse ox reads about 83. Yes. Okay. He said to do a 500 unit heparin bolus IV stat, and then do a heparin drip IV 130 units over an hour.
Okay, I will
Okay,
go get the medicine.
Before we do that, we gotta send him to CBC and PTT stat to get a baseline, and then he's gonna have a schedule stat CT scan for his chest to see. Okay, and then we're gonna be checking 8 hours PTT in 8 hours, and we're gonna titrate his O2 up to 90% to maintain. Okay, thank you, doctor. Yes. Bye.
I put your IV line there.
Okay, thank you. Okay, Mr. Grayson, we're gonna give you some medication, some heparin, to help you with your breathing, okay? Or with your chest pain, excuse me.
How will that help?
Well, heparin is a medication that's a blood thinner, and it just helps with to stop whatever's going on if you do have a embolism in your chest.
Is that understanding will help you, Mr. Garson?
Okay.
Oh,
Did you understand that, Mr. Garson, or do you want me to teach you further about that?
No, I think I
You
understand.
think you understand? Okay.
okay. Let me flush the IV. So this is medication, heparin medication that I will give you through the IV.
Okay, Bonnie. I prepped his ear for you. So how are you feeling, Mr. Garson? Are you feeling a bit better?
Just a little.
Just a little? Okay. I know they were kind of rough on you when you were doing your labs, but now you're back here. We can get you on this medication and on your way home.
Sounds good.
Sounds good? Great. Okay, Bunny. I'm going to turn this on for you.
Sure. I'm almost.
Okay, Mr. Garson, I'm going to just check your respirations again to see if that bolus helped you a little bit. Your pulse ox is about 90, 91 now, so it's a little bit better. I'm just going to check your heart rate. Okay, it sounds like it slowed down. Can you breathe a little bit for me? Okay, you sound pretty good. Okay. Let's get this blood pressure on you. Blood pressure cup. So how long have you been in Rockford, Mr. Garson?
About 15 years.
15 years? Wow. Do you like it?
Yes,
Yeah? Oh, I know. It's kind of cold here.
that's true.
Okay. I'm going to take your blood pressure now.
Okay.
Okay, your blood pressure went down. A few, it's about 140 over 80. So that's good. I'm gonna check your pulse again.
Your IV drip is also on, heparin. Looks like, let me check the pulse again. Pulse are getting better. Oxygen is 92%.
Okay, Mr. Garson, your pulse went down a bit. It's about 80 now. So that's good. We'll be back to check on you in a few, okay, Mr. Garson? Okay. Hi, Mr. Garson, we're back. We see that you've been here a few days. How are you feeling?
Much better.
Much better? You look a lot better. your doctor did order that you're going to be tapered off of heparin and you're going to be put on warfarin. That's another medication that you can take home. I'm sorry, I'm fixing your O2 thing. But that's a medication that you're going to be taking home, and it's going to be a lot less, that you won't have to get monitoring like all the time with. So heparin, you just come in and you get your maintenance blood test to see if you're in the right ranges and if the medication is just right for you. So if the ranges are too high for your blood, we're going to bring it down lower for you, or we're going to bring it up higher, the amount of medications for you, okay?
Okay.
And we just want you to know that you should try to eat healthy foods and keep your legs up when you're sitting, or have your TED hose. Have some TED hose so that you can walk, so you can perfuse, you can have blood perfusion circulating down to your feet. Do you have anything for him?
Yes, also doctor said to stay hydrated, drink some more water, and try to keep moving around, and also order the stocking for your
TED hose.
TED hose. Yeah, so you keep it on every day in the morning and take it out at night before you go to sleep.
Oh, again, with warfarin, you want to stay away from, what's that, vitamin K? Vitamin K and potassium, so that it wouldn't thicken your blood. So you want your blood to be just in the right range for your
Circulation.
warfarin. Yeah, circulation. Okay?
Is that help you to understand?
Yes, I understand.
Do you have any questions for us, Mr. Garson?
No, I don't think
No? Okay. Well, nice meeting you.